Hello everyone, welcome to the M3 Academy, and we are starting the blood transfusion reactions. Yes, blood transfusion reactions mnemonic. Yes, so first we are taking immunological reaction, then the non-immunological reaction. This topic is very important, and we already discussed the blood component in the mnemonic form. This is also important. So each and every exam there is a question on the blood component and blood transfusion. Yes, and also hematology is very important by the point of view of the pathology and the medicine. Yes, so we already conducted so many session on the AML, hairy cell leukemia. Yes, and the link already uploaded on the topic group Telegram. Yes, you can see from there. Yes, so please comment about the audio visual so we can start the session. Yes. So first, our first topic, first reaction is anaphylactic transfusion reaction. Anaphylactic started from the A. Anaphylactic started from the A. You can say this is due to IgA deficient. Yes, common in IgA deficient recipient. Yes, so just remember A for anaphylaxis, A for IgA deficient. Recipient on the symptom is like anaphylaxis symptoms, angioedema, A for angioedema, respiratory distress, and shock. And treatment, obviously, you have to stop the transfusion in any type of the transfusion reaction. So stop the transfusion and give the adrenaline. So what is the drug of choice for anaphylactic reaction is adrenaline. So we have to give adrenaline. And prevention is we are using IgA deficient plasma, and this happens achanak se. Achanak se means in seconds or in minutes. So just remember the key letter here A. A means IgA deficient recipient. A means angioedema symptoms. A for adrenaline is the drug of choice. A for IgA deficient plasma using for the prevention. A for अचानक से means seconds और minutes में होता है, इसलिए एनाफाइलेक्सिस के लिए कहते हैं कि जो एड्रेनालिन है वो पहले से ही प्रिपेयर करके रखना पड़ता है। इसमें टाइम इसमें अपन वेट नहीं कर सकते। यस, सेकंड रिएक्शन इज एलर्जिक और अर्टिकेरियल ट्रांसफ्यूजन रिएक्शन. So allergic or urticarial transfusion reaction mediated by the IgE. Yes, eosinophil IgE. So it takes time. So 2 to 3 hours. इसमें 2 to 3 hours लगते हैं. So treatment is antihistaminic, obviously anti-allergic medication, antihistaminic. Yes. So next transfusion reaction is FNSTR, febrile non-hemolytic transfusion reaction, and this is the most common complication of the blood transfusion. This question already asked is the one line in the NEET PG. Yes, this is your NEET PG PYQ. If you solve the previous year question, you see this question NEET PG PYQ, which is the most common blood transfusion reaction. Yes, so febrile non-hemolytic transfusion reaction is most common blood transfusion reaction, most common complication. Yes, and when you count the letter in this FNHTR 1, 2, 3, 4, 5. So around 5 to 6 letter in this. So this happen within the 6 hours. An antibody against the WBC and the HLA, so prevented by the leukoreduced product. Yes. So when you say febrile, so febrile means fever. Fever means WBC is increased. So somehow WBC is responsible for the fever. So we are reducing WBC in form of leukoreduced products. Yes, so leukoreduced products देके अपन इस reaction से बच सकते हैं. Yes, next is a trolley, and this is a NEET PG previous year topic. This is a hot topic. Many times the question asked on the trolley. Yes, so trolley is transfusion related acute lungs injury. Yes, so when you see this transfusion related acute lung injury means it's assembled like the ARDS, acute lung injury, but this is not a cardiogenic. This is the transfusion related. So non-cardiogenic pulmonary edema is there, and lungs injury means hypoxemia is there, bilateral pulmonary infiltrate is there. Yes, many feature you can easily predict by the name itself, lung injury. Yes, and when you count the alphabet in trolley 1, 2, 3, 4, 5, again the 4 to 5. So this is happening within the 5 means 6 hour, 5 to 6 hour, within the 5 to 6 hour. Yes, so antibody in the donor's plasma. Yes, so this is antibody in the donor's plasma. Yes, and against recipient HLA2 on the neutrophil. So this is also important, HLA2 and the neutrophil. And clinical feature we already discussed, hypoxemia, non-cardiogenic pulmonary edema, not responding to diuretic, chest X-ray, bilateral infiltrate. Yes, interstitial infiltrate, and this seen in the multiparous woman. Yes, multiparous donor woman. Yes, more frequently with the pre-existing lung disease and more common with the fresh frozen plasma and platelet, and mortality is 5 to 10%. Yes, mortality is 5 to 10%. Yes. So what is the key number here? Key number here you can predict like the trolley. Trolley means you can say 5 into 2 is equal to 10. Yes. So within the 5 hours, this reaction happening within the 5 hours. 2 means HLA2 is involved. 10 means 10. 5 to 10% is mortality. 5 to 10% mortality is there. Yes. So just remember 5 into 2 is 10. Yes. Yes. So again, you can say trolley T4, remember 2, so HLA2 is there. Yes, T4 TLC, the main TLC is neutrophil, so neutrophil is there. Yes, so you can say antibody against recipient HLA2 on the neutrophil. Each and every keyword is important. Neutrophil is important, 6R is important, HL2 is important. Yes, and the motility also is important. Most common with the fresh frozen plasma, this is also important. Yes, so now next transfusion reaction is acute hemolytic and delayed hemolytic. As the name suggests, acute and delayed. So acute within 24 hours, delayed more than 24 hours to week. Yes, so acute A4 you can remember acute hemolytic reaction. A4 ABO incompatibility is there. Yes, A4A you can match. A4 acute hemolytic reaction, A4 ABO incompatibility, and this is type 2 hypersensitivity reaction. So you know the mnemonic acid about the hypersensitivity reaction. Yes, can anybody tell me what is the mnemonic of the acid for the transfusion reaction? For the hypersensitivity reaction type 1, 2, 3, 4, and what is the mnemonic of the acid? Yes, so please revise the hypersensitivity mnemonics from the topic group. Yes, so acute A4 you can say ABO incompatibility. This is type 2 hypersensitivity reaction, and acute so IgM immunoglobulin. Yes, chronic means IgG immunoglobulin. So IgM. Yes, and patient present with flank and back pain, sense of impending doom, Coombs test positive, pink plasma, hemoglobin urea, renal failure. ये सब मिलेंगे. So back pain is written in the question when you solve the multiple choice question. Yes, delayed more than 24 hours, and IgG immunoglobulin. So I will remember when you write immunoglobulin. So in the spelling of the immunoglobulin, M come first, then the G. So M appear in recent infection, recent things. G come on the delayed things. Yes. Now next is a non-immune reaction. Non-immune reaction. So infectious complication more with the platelet transfusion. Yes, and transfusion associated circulatory overload, hypothermia, and when the this ट्रांसफ्यूजन रिएक्शन हैपनिंग दिस सेल इज ब्रेकिंग, तो इसमें क्या होता है सेल ब्रस्ट होती है, सेल ब्रेक होती है, सेल के अंदर ज्यादा क्या होता है पोटेशियम वो बाहर आता है, तो क्या हो जाएगा हाइपरकेलीमिया. यस, so in inside the cell, intracellular, yes, intracellular compartment, intracellular fluid, which thing is more? Yes, all the thing started from the P. P means pani, P means potassium, P means protein, P means phosphate. Yes, all the P means pH. So सारे P वाली चीजें सेल के इंट्रासेलुलर फ्लूइड में ज्यादा होती है. जब ये सेल डिस्टर्ब होगी, सेल यहाँ से टूटेगी, तो अंदर का सारा पी बाहर आ जाएगा, मीन्स अंदर का सारा पोटेशियम बाहर आ जाएगा, तो यहाँ पे क्या मिलेगा हाइपरकेलीमिया. यस, एंड हाइपोकैल्सीमिया बिकॉज द calcium citrate combined with the calcium, so hypocalcemia. Iron overload, immunomodulation, and transient hypotension is there. Infection, you can say viral means hepatitis A, B, C, G, HIV, CMV, EBV, STLV first, second, and parvovirus B19. In bacterial, syphilis, and parasite, malaria, babesia, other Jacob prion disease. Yes, so hepatitis C is the most common cause of the transfusion associated hepatitis. So common means C, hepatitis means C. Most common hepatitis is hepatitis C for the transfusion associated hepatitis. Yes, massive transfusion. So what is the definition of massive transfusion? Yes, so one in one means more than one time of the total blood volume within the 24 hours. Yes, so you can say 24 hours means 1 day, 1 day. So you can match one in one more than one time in the 1 day. Yes, more than one time in the blood volume in the 1 day, or you can say more than 10 यूनिट ऑफ द ब्लड, मोर देन 10 यूनिट ऑफ द ब्लड, यस यूनिट में देखेंगे तो क्या बोलेंगे 10 यूनिट, यस। और यू कैन से रिप्लेसमेंट ऑफ मोर देन 50% ऑफ द ब्लड वॉल्यूम विद इन द 3 hours, within replacement of the more than 50% of the blood volume in the 3 hours, yes। so you can say 10 यूनिट एक दिन में 10 यूनिट, तो मैसिव मीन्स बहुत ज्यादा ब्लड ट्रांसफ्यूज कर रहे हो, तो ये कहेगा 10 अब 10, 10 अब 10। सो मैसिव ब्लड ट्रांसफ्यूजन को अपने कहना पड़ेगा 10 अब 10, 10 अब 10 ना। मैसिव ट्रांसफ्यूजन अपनी चाहिए, सो 10 यूनिट से ज्यादा एक दिन में, मोर देन 50%, 3 hours में, यस। और कॉम्प्लिकेशन क्या हो सकते हैं, मेटाबॉलिक अल्कलोसिस इज मोर कॉमन देन एसिडोसिस, सो मोर कॉमन इलेक्ट्रोलाइट एबनॉर्मलिटी, मोस्ट कॉमन acid based balance abnormalities, metabolic alkalosis. This question also asked previously. Now, so this hyperkalemia can cause ventricular arrhythmia, yes, or cardiac arrest, and hypokalemia also happen, but this is rare, yes। So hypocalcemia, or you can say citrate toxicity, yes, citrate toxicity or hypomagnesemia, and there is a dilutional thrombocytopenia. This is most common cause of bleeding, and hypothermia. This complication may be happen. So important thing in this blood transfusion reaction is the key numbers. Just what is happening in seconds, anaphylactic, what is happening in the minutes, what is happening in the hours, allergic, what is happening in the within the 6 hour is a febrile non-hemolytic transfusion reaction or the TRALI, yes, which is associated with the neutrophil and HLA2 is TRALI, yes, 5 to 10% mortality is TRALI, yes, and acute and delayed difference is 24, yes, difference is 24 hours. So, and again definition with the massive transfusion, more than 10 unit, yes, more than one times total blood volume in a one day, or more than 50% within the 3 hours. So all the game of the numbers only, yes, in the transfusion reaction. So please revise this topic. I will share the PDF on the pathology section. Yes. So thanks for the participation.